like to welcome Senator Emmett to This Week in Richmond. Emmett's been serving in the Senate since 1996, but prior to that, from 1983, 1992, served in the House of Delegates.
That's correct, right.
From the great Shenandoah Valley, Virginia. So talk about any issues that you'd like to help people better understand some of the issues that you all are wrestling with here at the end of the session.
Well, there's quite a number of them, and I've specifically been involved. Each year I seem to be involved in environmental issues, conservation issues, and this year is no exception, working on some issues relative to clean up the Chesapeake Bay. This year I've had a number of initiatives in the educational arena as well, and of course in the backdrop of all of it this year is my involvement with healthcare reform, and specifically how we're going to react with the decision we need to make in Virginia as far as whether or not we would extend affordable access to health care to lower income Virginians in a more comprehensive way. So got all three of those areas out there, and I'd be glad to speak to any one of them that you'd like to talk about.
Well, why don't you start with the last one, because while there is certainly differences of opinion, there also seems to be some, at times, misunderstanding of what's being proposed over in the Senate.
Okay. Well, just to step back a moment, I think everybody is being hearing, but in fact, millions and millions of dollars have been spent in efforts to inform us about Obamacare or the Affordable Care Act and potentially expanding Medicaid. But very little of it has been directed in a nonpartisan, objective way. Most of it is coming from one side or the other that's just trying to sell their message. So, if we assume that people are understanding, it is tough to understand. But the basic bottom line is Medicaid, not Medicare. Medicare is a program, of course, we're familiar with for individuals 65 and older. That works very well, actually. It's a paid-for program. Some people who are disabled can also fit in under Medicare. That's one program. It's a federally administered program. Medicaid, on the other hand, is a state-administered program. So whether or not the Affordable Care Act was going to be overturned was being heard in the Supreme Court, they ruled, and I think correctly so, that Medicaid is a state program, and states have the decision to make as far as the operation of that program, including who is eligible and the conditions under which they would be eligible and the payment rates and what have you. So that kind of upset the apple cart, if you will, because it had been anticipated under the provisions of the Affordable Care Act that all of the states would expand their Medicaid programs. Well, we're wrestling here in Virginia now with how best to deal with that. The problem, there are a number of problems and opportunities inherent in it, and I'm grappling for the opportunity. And that opportunity is that we have not been able to come to grips in this country and in Virginia with health care in general. The costs are rising tremendously. They're on a steep incline, and we're getting to the point where we have great health care if you can afford it. But more and more people are dropping out of affordability in terms of not being able to afford insurance, and more dollars are being required to maintain commercial insurance packages. So that's the big broad subject, healthcare reform. So I'm working on that. Within that, we have to decide, we have a decision to make as far as accessing federal dollars that we're currently being taxed or assessed as a part of the Affordable Care Act. A lot of Virginians it hasn't hit them directly yet, but the Affordable Care Act is being paid for with a series of new fees and taxes and some cuts that hit hospitals. And so those cuts that hit hospitals particularly are a source of immediate urgency. They had agreed as a part of the Affordable Care Act that reimbursements under Medicare would be reduced, that payments for indigent or individuals that show up at hospitals that don't have the ability to pay, that get treated, would be paid for in a different way than they currently were being paid for, either through federal funds and through state taxpayer dollars. So we have, the figure comes to over $2 billion annually. Some have suggested the figure is about $2.9 billion that we're currently paying to the federal treasury. And in order to receive some of that money back, it is intended that we set up some way for an expanded population of lower income Virginians to have either access to health insurance or access to health care in some manner. And so the plan that I've been working on, and there's been a lot of work done on this. I've been chairing a Medicaid Innovation Reform Commission where the first thing people will say about Medicaid, oh, it's a broken system, a lot of fraud, waste, and abuse, it's not efficient. Well, we've been working on that, and we've made significant strides over the past year in implementing various reforms, which already are saving us literally hundreds of thousands of dollars in the state budget. But the decision at hand is expanding the population so we qualify for some of those federal dollars back. And we've come up with a private option, which it really is a composite of some of the actions that other states are taking. Arkansas, Iowa, Michigan, Wisconsin, quite a number of states are working on not just direct Medicaid expansion, but a plan where private insurers can be incentivized or impart the insurance premiums paid from this fund of federal dollars that we can access. I support it. I think it's a wise way to go. From an economic standpoint, I don't think we can afford not to do it. And from a humanitarian standpoint, certainly I think it has become what some have referred to as a moral imperative that we do it, because the current system that we have simply creates impediments for people of lower income to be able to get affordable access to health care, particularly in a timely manner. You can get it if you go to a hospital after you've had an illness for a while and you want treatment, you'll get treatment, but chances are you would have put it off because you were afraid it would bankrupt your family. You didn't have insurance or the money to pay for the fees, and so you put it off as long as you can, and you show up at the hospital in the emergency room, and in many instances, and we hear about it all the time, it's just too late. You're not going to have a good outcome, and there'll either be a death or a shortened lifespan associated with that lack of timely health care.
So that's the issue that will keep the two chambers working to try to particularly reconcile the difference between the House position and the Senate.
And there is a distinct difference between the House and Senate on that, and I'm hoping we can bridge the divide. And it's a deeply dividing political issue as well. There are a lot of groups that are invested in the outcomes and trying to influence the outcomes. Some of them are reasonable and working with facts. Others are just, unfortunately, there are a number of them that anything associated with the Obama administration they want to see defeated. They don't care whether it's good policy or not. And you'll find that there's a countervailing feeling on from some of the other more liberal advocacy groups. But the truth of the matter is we can't, and this is what I continue to reiterate whenever I have a chance, we can't afford to do nothing. Now, Virginia needs to take some leadership here because I'm a strong supporter of life, but you also have to look at quality of life. And when you have a system that increasingly is pricing people out of the market so they don't have access to health care without bankrupting their family, then you got to do something. And I think the time is long overdue for us to do something.
Well, thank you for laying that explanation out. Now, you mentioned too the environmental issues that you've worked on for many years on Agriculture, Conservation, Natural Resources Committee.
Right.
Any big issue?
Well, I've been involved with our strategies to clean up the waters of the state. And on that, of course, we're trying specifically to clean up the tributaries going into Chesapeake Bay, making good progress there. We've had great success, I think, with agricultural best management practices and taking steps to keep nitrogen and phosphorus and sediment out of the waters flowing into the bay. And we've also expended a lot of state and local dollars upgrading our waste treatment facilities. So we're seeing measurable success in terms of restoring the fisheries and when you test the waters. And so that's positive. The one area where we have not made as much progress is stormwater management. And so that's been a focus this year. I've carried legislation in the past, and this year I'm carrying legislation as well, which basically is putting in place some policy, and hopefully with appropriate funding, so that we can more aggressively clean up the more urban areas of the Commonwealth, where we are continuing to kind of flush our streets out and dump all of that spill into the waters and into the bay. So over the course of this session, we've had stakeholder groups working on the legislation that I'm carrying that's also in the House. that I believe is going to be very beneficial in our long-term effort to clean up the bay and the state waters. So I'm real pleased about that progress.
Senator Hanger, thank you so much. Time is running out. We're going to have you back on sometime to talk about education and
I'd
other
love to
issues.
do that.
But we thank you for being on This Week in Richmond.
Okay, thank you, Dave. Appreciate it.